My name is Jeff Issner. I'm one of the co-founders of Engaged MD. Today, I'll be speaking a little bit about how you can use technology and the data that comes from that technology to optimize your patient experience. So as we're all aware, the world of IVF is moving at neck-breaking speed. The equipment we have in our laboratories, the protocols that we're using, the genetic testing that's available to our patients has really advanced the way that we treat our patients and the success rates that comes from that treatment. But in the 41 years since the birth of the first IVF baby, the patient experience has remained very manual and largely unchanged. So let's take a closer look at a typical patient journey. First, the person needs to find a provider they're comfortable with, delve through all of the unreliable information that's scattered across the various blogs, forums, Dr. Google. They have to deal with the fear of the unknown as they wait for their initial consultation. After that appointment, they generally need to go through various types of diagnostic testing to better understand their treatment options. They then need to figure out what the cost is and how they'll actually pay for treatment, all the different add-ons, including genetic testing. They have to truly provide their informed consent, showing that they understand all of the process, the benefits, the risks, the alternatives of treatments. They go through their cycle with tons of medications and injections that they need to understand how to use and hopefully not make a mistake along the way. Ideally, it's successful and a patient becomes pregnant and has a healthy baby, but if not, they've got to make the decision to potentially try all of this again and go through the entire process one more time. Does it sound overwhelming? It's because it really is for your patients and for your clinical team. And I think anecdotally, we all recognize that the patient experience matters, but some hard data to support that. Patient drop-off rates from initial consultation to actually starting a treatment cycle can be as high as 25 to 50% at even the most efficient clinics. And while there are many reasons that patients may drop out from treatment, studies have shown that patient distress is the primary reason patients with complete insurance coverage having IVF make the decision to stop treatment. And in today's day and age, success rates are not enough to differentiate. Every single patient experience is being documented, whether it's in Facebook or Yelp or Fertility IQ. You've got to be better than the person across the street from you. So to exacerbate this issue even more, we know that more patients are going to be seeking treatment. The cost of treatment and reimbursement continues to go down. And time in your day, well, I think the emoji says it all. There isn't enough to truly give each and every patient the experience that you would like to if you had the time to hold each and every one of their hands. So at EngageMD, we've addressed this problem by reinventing the way that we perform patient education and informed consent. We think that you should meet patients where they already are, online, on their cell phones. Take the redundant parts of treatment and automate them so that when you do have that really valuable in-person time together, you can be focused on the nuance of each patient's specific care plan and their specific questions and concerns. By doing so, we can actually reduce the burden on the doctors and the nurses and your practice staff so that you can really truly provide that optimal patient experience. So we've approached the parts of the patient's experience that I've highlighted in green on this slide, and we continue to create more and more modules to address more and more parts of the patient experience. But today I'd like to focus on genetic testing options. We've partnered with Cooper Surgical to create a series of educational modules that cover everything a patient needs to know about PGTA, PGTM, and endometrial receptivity, or the ERP test. You can provide these modules to patients so that they learn at home on their own time. They can rewatch them as many times as they want and come back into the clinic with a thorough understanding of everything that they need to know in order to make an informed decision. You have access to all of this information at your clinic so you can see exactly what patients have watched and where they've had trouble or concerns. When patients do decide to move forward with testing, we've automated the test requisition process as well, so you can digitally fill out all of the test requisition forms. They'll automatically land in Cooper Genomics' hands with all of the information complete, accurate, and legible. So the best part about all of this is that it's completely free to Cooper Genomics customers. Sounds really great, but does it actually work? We were fortunate enough to have a third party group of independent researchers take on EngageMD and study it. And the results were truly phenomenal. So a few of the key findings: 83% of patients felt that EngageMD improved satisfaction with their care. 77% of patients agreed or strongly agreed that EngageMD made them more comfortable actually pursuing treatment. And 86% of patients agreed or strongly agreed that EngageMD actually better prepared them to sign their informed consent documents. So we've proved that we can improve patient satisfaction, reduce drop-off rates, and really simplify and improve the informed consent provided. But if the patient wins, everyone wins. In the study, we also showed that we can save valuable clinician time and improve patient education, which has enormous impacts on your clinic's operations and satisfaction as well. Just one example from one of our client customers, Bios Fertility, they were able to pare down their 60 to 90-minute patient education appointments to just 15-minute consults that were focused on individual patient needs. So it doesn't stop there. You've implemented all this great technology at your clinic, but you have all of this data at your fingertips. You've got to use that data to really optimize the interactions and the processes along the way. So this is just a small example of data that we extract for our clinics from EngageMD, and it shows the different interactions that patients are having through modules being assigned, the emails actually landing in an inbox, how many times they're open, when they're clicked, when people actually start the modules and then complete the modules. And you can use data like this to dive in and understand where your processes may be broken, fix them, and continue to measure. So I'll leave you with the four A's. Acknowledge your practice has created a lot of data through your EMR, through other technology that you've implemented. Use this technology to automate reporting and other technology, and make sure that reporting and analytics regarding patient experience and engagement is easily accessible by the right team members. Last but not least, hold your team accountable to utilize this data to continuously optimize the patient experience.